What's up, everybody? I am pumped because this is episode 90 of the Everything Medicare Podcast. For those of you who do not know my name, I am Christian Brindle. I run a company called Christian Brindle Insurance Services where we work with people on Medicare all over the place in 4 states at the moment. Been doing this for a long time. I grew up around the insurance industry. This is the Everything Medicare Podcast, where every single week we bring you podcasts where we discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement. And today, we're going to be talking about what to watch out for during the Medicare enrollment period. And the reason why I'm so pumped up is there's 2 reasons. Like I said just a second ago, we made it to 90 episodes. And when we first started this podcast, it started out with me talking about Medicare. The first episode we ever did was What is Medicare? It's been our most listened to episode by far. And, you know, we just started, we started by, saying, let's try this out. Okay, let's see how this goes. Let's see if anybody even listens. Let's see if this is an effective way for us to help people with their Medicare. And, damn it, it was. It is. And I hear from people all the time, all over the country, that says, hey, I was confused. I listened to your podcasts, and it helped me. And you helped me. And I'm so thrilled with that. I'm so thrilled that we've put out content that's been meaningful, effective, and has been able to kind of impact people's lives on Medicare for the better. That's what I wanted to do. That's what I wanted to do. I just think that it's just disgusting how little quality information there is on the internet today about Medicare, especially because we live in the digital age, folks. We live in the digital age. Every single person watching this is relatively tech savvy. I am 100% sure of that because you're listening to a podcast, okay? Podcast is a very 2010 on type of concept. It doesn't mean it wasn't going on before that, but it's really become a mainstream idea in the 2010s period, in the 21st century, if you will. And when we started this podcast, I wanted to find a way to put out information in almost in the form of a library, okay? So and we've done that. We have 90 high-quality episodes. All of them discuss a different topic, or we've brought somebody on who's just an expert, very, very qualified individual to talk about Medicare or something that has to do with Medicare. This is what we've created here. I feel very, very proud of, because we've created a library for anybody that's confused about Medicare. If you just binge our episodes from 1 through episode 90, this one I'm doing right here, you'll know more about Medicare than probably 99% of people that work in the Medicare industry. I'm 100% confident of that. And for me personally, folks, I've always been, ever since I got involved in this industry, I've been a nerd, a Medicare nerd. I read everything there is to read. I study. I just want to constantly learn more. And it's because of that I have the knowledge base about Medicare that I do. People that work for particular insurance companies that are in high places of Medicare sales, or for that particular company, I know more about Medicare than a lot of them. I've learned over the years, and I learned really quickly that people that work for these insurance companies, I know more than they do. People that are my peers, I know more about Medicare than a lot of them. Very, very few people in my industry know more about Medicare than I do. In such a short amount of time for me being in this industry. I've been in this industry, actually, I wouldn't say a short amount of time, but at my age, I'm 27 years old. And it's just because I have a passion for it. And I love what I do. And for me to be able to help you, I need to know my stuff. Okay? So that's number one. the number two reason why I'm so excited is because we are just about a month away from October 1st, which is the start of the craziness, which is the Medicare enrollment period. And it's my favorite time of the year because basically I just, throw myself into my work. And I'm a little odd in that regard. I'm a little odd. People think I'm kind of weird in a lot of ways, and I suppose I am. I love what I do. I love it. I love working with people on Medicare. And I talk to more people during the enrollment period than any other time of the year. If we were a tax office, this would be like our tax season. And today, folks, I wanted to bring you an episode where we can talk about three things that I see year after year after year after year. This has got to be I don't know how many enrollment periods I've been through, but it's been multiple for years, since I was 20 years old. And this is something, these three things I'm going to talk about are something I see people deal with every single enrollment period. Every single Medicare enrollment period. So buckle in, let's talk about it. So the first thing that I see people deal with when it comes to the enrollment period. Now, more often than anything else, people that are impacted by the enrollment period are people on Medicare Advantage. Part D2, Medicare Part D drug plans, that go with Medicare Supplement, Medigap policies, but mainly Medicare Advantage plans. So this episode is probably going to lean towards, and speak to the people that have Medicare Advantage plans more than anything else. So just a disclaimer there. So Medicare Advantage plans, okay? One thing you need to understand before I jump into my number one thing that you need to watch for is Medicare Advantage plans are specifically designed for specific service areas based on where you live. And even if you live in, let's say, Florida, a state I'm very familiar with, live there, work with a tremendous amount of people there, licensed there, have many clients there, know the market very, 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 very well. So we'll pick on Florida for a second. Florida's a great example of this too. Some of the bigger states, just because you live in Florida doesn't mean you'll have the same plan as other people that live in Florida. Because Florida is so big, there's so many counties, that the plans will be completely different if you live in Jacksonville than it would be for someone that lives in Miami, let's say, from one end of the state to another. So depending on the size of your state, service area does not mean state by state. Service area means particular areas of the state. Even in Utah, where I live, there's the plans in southern Utah, the St. George area, if you know Utah very well, is completely different than the plans in the Salt Lake area. So plans for Medicare Advantage plans differ based on service areas, and service areas sometimes can differ within the same state if you have a large enough state. States like California, Florida, Texas are great examples of this, where they have multiple different service areas for different insurance companies that do Medicare Advantage plans. So every year, there are Medicare Advantage plans through different carriers all across the nation that do what's called a pull out of a county. They completely pull their plan out of a county or a service area, particularly. It could be one or the other. They could pull out of a specific service area, which might consist of multiple counties. They might just pull out of one county, the plan. But it happens every year. Now, does it happen that much, in all things considered, comparing it to the amount of Medicare Advantage plans that don't pull out of counties? No, it's probably a very low percentage, but it still happens every year around the country in some markets. So what you need to watch for is you should know anyway, if your plan pulls out of the county. But I see every year that people have their plan pull out of the county. What I mean by pull out of the county is they're going to cancel you next year. They're going to pull the plan out of the county and they're not offering it anymore at the end of the current calendar year. And starting January 1st, that plan doesn't exist anymore for people that live in that particular county or service area. So, a plan is required to notify you of this. Typically, the insurance company will notify you probably sometime in September, if not the end of September, but it could be as late as the first or second week of October. I've seen it vary depending on the insurance company. So, is it likely to happen? Probably not. It's probably less than 5%, maybe less than 10% actually, of the Medicare Advantage plans from year to year might do that. But it happens every year in different areas. Every year there are plans that pull out of counties across the United States of America. And every single market is listening to this podcast. So some of you may be impacted by something like this. What you need to watch out for is watch your mail. Watch your mail. Look at everything you get in the mail from your insurance company or particular insurance carrier. Because that's how they're going to notify you. They're going to send you a letter, and the people that don't look at their mail are the ones that end up not knowing they're canceled, and it goes all the way to January, and by that point, they don't have a plan. Now, typically, they have a window of cancellation that they're able to get on a plan for, but let's say they wait till January. They can get on a plan still in most cases. They usually have till February, the end of February, depending, but their plan won't start till the first of the coming month. So they're stuck a month without insurance. This happens to people every year when plans pull out of counties. Don't be that person. Keep an eye in the mail. If you receive something called an ANOC, an annual notice of change that shows your benefits on your current plan for the next coming year, you know that you're probably safe. You're not going to have your plan pull out of the county. And 99% of the time it's not going to happen, but it does happen in different markets with different insurance companies. So keep an eye out for that. You don't want to be the person that's left with no coverage temporarily. Or go to the doctor, show your card, and it doesn't work anymore. You don't want to be that person. Keep an eye in the mail. Don't throw things away that comes from your insurance company unless you read it. Now, are you going to open things that are probably advertisements from your insurance company that they just send out in bulk and they don't realize they're sending it to you? Yes, but it's worth it. Make sure you keep an eye on this stuff. You don't want to be canceled. Stay with me into segment 2 and we'll break into the other 2 things that are vital to watch for the enrollment period. Stay tuned. Don't go anywhere. I'll be right back. Welcome back, folks. This is segment 2, this week's episode 90, Everything Medicare Podcast. I'm Christian Brindle, your host, and today we're talking about 3 things that you need to watch out for and be prepared for and be aware of going into the Medicare enrollment period. You can't make changes during the Medicare enrollment period till October 15th, and that goes through December 7th. However, the madness will start October 1st. You're going to start seeing the advertisements, the commercials. You probably will get some phone calls, even though they're not supposed to do that. You might even have someone show up on your doorstep, as ridiculously illegal as that is. Okay. Unless you sent them some kind of document in the mail saying you want information. Then they can call you. Then they can show up on your doorstep. Then you've pretty much given them free rein to do that. Not saying that's a bad or good thing. I mean, if you want information, then that's probably fine. You might want somebody to come and talk with you. But keep that in mind. So the first thing we talked about in segment 1 was Medicare Advantage plans pulling out of counties or service areas. To make sure, just to refresh, to make sure that doesn't happen to you and to make sure you're aware of it, just watch your mail. Read your mail that come from your insurance company. That's how you know. That's how they're going to notify you. They're not going to call you. Your agent probably won't call you. 90% of insurance agents are flakes. Hate to say it, folks. Hate to say that. I probably shouldn't even say that terminology, but I did. I thought it's true. 90% of insurance agents either don't make it in the business or they don't take care of their clients or customers. A lot of them do, but more of them don't. So don't depend on your broker to keep you posted. Okay? I've seen brokers, lots of brokers, actually, where there's been plan cancellations in my home state in Utah, and they don't do anything. They just let them go. Dumb. Okay? So let's talk about the 2 other things that you should be watching for. Okay? So number 2, make sure you understand what your plan changes are going to be going into the next year. Make sure. I don't care how much you've liked your plan the last 3 years. I don't care. Because what your plan has been the last 3 years is not necessarily what it's going to be next year. Make sure you're reading your ANOC, which stands for Annual Notice of Change, the book they send you every year that compares this year's benefits with next year's benefits. It's very easy to understand. They typically have the benefits side by side, 2019 on the left, 2020 on the right, and they typically only have in that book what's changing next year. So go through the book. Skim through it even is better than nothing. Skim through it. Look at the changes. Make sure it's going to still be a plan that you want to stay on, because it's very possible that a Medicare Advantage plan can go down the toilet even in a year. Is it likely? No, not probably likely. Usually plans don't change that much, but they can depend in your particular market. Maybe it depends on the market. Compare your plan. Know what your plan is being changed to going into next year. It's vitally important. I encourage you to know what your plan changes are going to be. Very important. Very, very important. And let's say you get your ANOC, your Annual Notice of Change, and you go through it, everything looks good, you're happy. Make sure that your prescriptions are still going to be covered, because the ANOC's not going to go over the prescription formulary. And they can change those from year to year as well. Let's say you're taking a medication that's a tier 2, and it's being up to a tier 3. That's a big difference in cost for you. It's a big difference in copay. Make sure you're checking on that. Okay? So just know what your plan is changing to. Know what your plan is changing to. Okay? Before you just say you want to blindly stick with it because it's worked well so far. You have to know what it's changing to. Have to. Because it could be fantastic this year and it could be trash next year. So keep this in mind. Some markets, plans change just a little bit. Some markets, plans change dramatically. It depends on the year, it depends on the market, it depends on the insurance company. So do yourself a favor, keep up on the change. It's very, very easy to do by looking at your ANOC, your Annual Notice of Change. What we do is we keep our people posted. So you don't really have to do much work. But most people don't do what we do. Okay? At my office, in my company. Number three. Let's say you get your Annual Notice of Change. You did what I recommended in number 2. And you compare this year to next year. Let's say your plan is going down the toilet. You don't like what's changing. The changes dramatically impact you in a negative way. So you start shopping for a new plan. Well, this is vital too. Make sure the new plan, you understand everything about it. Make sure you understand how it covers your medications. Make sure you understand what hospitals and doctors you can go to. Make sure you understand all of the benefits, because you need to make sure that you're not changing from one plan to another. Let's say you change from plan A to plan B because plan B has a little bit more dental benefits, but let's say plan B doesn't cover any of your doctors. I see people do this all the time. Don't be that person. Make sure that it's an upgrade in every area that you need, because most people would probably rather keep their doctor than get a little bit more dental benefits. Dental benefits are great. They're important. Don't get me wrong. But you need to make sure that you're getting everything you need on the plan, because there's many working parts when it comes to a Medicare Advantage plan. Medicare Advantage plan gives you medical benefits. Typically, they give you prescription benefits, although there are plans that don't have prescription benefits. Typically, you're going to get some extra benefits, not with all plans, but a lot of times you'll get some kind of dental, vision, hearing coverage and extra benefits, gym memberships, things like that. You got to make sure that all the working parts fall in line with what your goals are for your coverage and what it's supposed to look like. Okay? Very, very simple. Very, very easy. Anybody can do it. This will make sure that you have a much, much less stressful Medicare enrollment period by doing these 3 things I just talked about. Stay with me. Don't go anywhere. Segment 3 is coming right up. Welcome back, folks. Thanks for sticking with us all the way to the end. I really, really hope you got a lot out of this episode. The Medicare enrollment period can be a crazy time for a lot of people. Everywhere you look, you're going to see advertisements everywhere you look. I can't stress this enough. You're going to see people sitting in booths when you go to the store. Probably any grocery store, you're going to see people sitting in booths. I did a whole episode about agents sitting in booths, and I just put them on blast. Okay, I've done it. I did it when I was a new agent. Nobody sits in a Medicare booth unless they're a new freaking agent. And I've talked to you how I feel about working with brand new agents. I mean, don't get me wrong, people got to start somewhere. They got to learn, and you're not born knowing this stuff. But for you as the consumer, for you as the beneficiary, it's probably not in your best interest because they're going to not know that much starting out. So the reason why I say, just to refresh on that episode, go back and listen to it if you want to hear it all, but I'm not going to tell you everything that I talked about. But agents that sit in Medicare booths during the enrollment period, you know they're new. You know they're new because no one else has the time during the enrollment period to sit in a booth for hours every day. I don't. Nobody I know that's an established person has the time to do that. Working crazy hours. 80, 90, 100 hours a week. You don't have time to do that. Shit. Excuse my French. You don't have time to do that stuff if you're an experienced agent. So keep that in mind. You're going to see agents sitting in booths. You might have people come to your door. You might have people calling you, probably many, many people calling. You're going to see commercials up the yin-yang. You'll see certain insurance companies that starts with an H. I'm not going to say who they are. Typically, they'll have an entire show, an hour-long show on a lot of channels. The advertising is going to be crazy. But if you do what I told you to do, you're going to be better off than most everybody else. Because most everybody else doesn't do what I just recommended, these 3 things. As always, folks, if you're going into the enrollment period and you're just not sure if you like your plan, you just need some help, you need some guidance. Let's say you're on an island, or maybe you don't like your agent retired or no longer in the business. There's a million different situations that I see people run into. You're always welcome to call my office. I'd be happy to talk with you, and who knows, maybe I can do a better plan for you than what you have. My company, Christian Brindle Insurance Services, works with all of the largest insurance companies in the industry. We go through the different options to find you the best available fit based on your needs and preferences. We give you an unbiased perspective. And worst case scenario, we take a look at your plan. You're on the best available plan for you, and you can sleep better at night knowing that, and we're glad we took a look at it too, because we wanted to make sure that you were on the best thing for you. We are licensed to work with people in, obviously, the state of Utah. That's where our office is. Florida, Idaho, and most recently, Oregon. So if you live in one of those 4 states, and we're always adding more states, so stay tuned for that. But if you're licensed in one of those 4 states, give my office a call. Talk to me during the enrollment period. Let's talk. Let's see what we can do. Let's see if we can improve your situation. And then you're going to be working with an organization and an individual and myself that's going to be here year in, year out, working hard for you. Our office number is 801-255-5340, 801-255-5340. Our office hours are Monday through Friday, 9:30 a.m. to 4:30 p.m. Mountain Standard Time. But if you'd feel more comfortable shooting me an email directly, you're more than welcome to do that as well. My email address is Christian, Christian, B as in boy, @xmission.com, christianb@xmission.com, Christian, B as in boy, @xmission.com. And until the end of the month, we still have about not much time left, a few days, but until the end of August, we're still doing our free book giveaway for Medicare Guidance, my book, Picking the Plan for You, that I wrote. All you have to do to get the free book is go to Apple Podcasts, leave us a 5-star review, say something nice that you like about the podcast, take a picture of it, email it to me, and include your first name and the best place that I can mail the book to you. Anywhere in the United States of America, I will send the book to you for free if you follow that. We're doing that until the end of August. After that, you'll have to pay for the book to be able to get it, unless you're a client of mine. And then at that case, you always get the book for free. But that is still going. Don't miss out on that. As always, folks, thank you so much for listening. We appreciate you so much. Thank you for helping us reach 90 episodes. And before we know it, we'll be at 100 episodes. And we feel so strong and so confident that we're going to be able to reach so many more people and just make this stuff easy. Thanks so much for listening. Have a great day.